Does my child have an ear infection, or is it just teething? Now, just teething is such a big statement because what we don't do, and we're going to explore today, the eruption of alveolar bone in the face is where the body is pushing teeth down and pushing teeth up into the skull. So it creates a real face ache for our infants. What we need to realize is that heat and ache is something they will commonly use us as parents to soothe for. They don't have a reference for pain and problems, and especially when it's up in your grill and in your face, you want to soothe with who you know best. So snuggling in, putting pressure, biting are common signs that there is a lot going on. The body will produce extra mucus to make sure that it breaks down the gum and allows the tartar to soften so that the teeth can come through. And then what that can do to the rest of the gastric tract is make it more acidic. And it also then, that's why they often get a red bottom around the exit of the gastric tract, because there is acidity of the mucus. So they're all very normal, common things, the dribbling out of the face because of that. It also makes them less likely to want to eat because A, it's sore, B, it's more acidic. So we have to compensate for that. And of course, Mother Nature's always got a great design. When you can adjust a child, you can help their nervous system coordinate all those things better, because there's a lot going on. And it takes about 3 months, even before teeth arrive, of that heat and eruption. So as parents, we've got to go through a checklist so we don't panic. First one, is it heat in the head only, or is it heat in the body? Because that indicates head heat will be eruption of bone. Whole body temperature can be fighting infection. Now, it is important to note that infection will also go in through the cracks in the gum more readily, first portal of entry. So we want to make the body more resilient so that it is not going to have so much infection, so potential for infection. So a mother's breast milk will change to make sure that the breast milk has got increased immunity for the baby. So feeding the baby more breast milk is going to be very, very important. When that can't happen, and even when it is happening, you want to fortify the mother's immune system to help the milk become stronger from what she's eating. But secondly, even if you can't breastfeed, what God has done is put incredible capacity in cloves, pure cloves. One single clove will have the perfect amount of oil. And what we do is we put it in our mouth, because the saliva and the good bacteria that we have in our gastric tract will imbue into that. And when the clove starts to feel like it's numbing my gum, then what I'll do is I will take the piece of wood out and I'll squeeze it so that the oil from that clove will go onto my fingers. Then I would chew it and eat it because it's so good for you and it feeds all your bacteria. Then I would rub it, the clove oil, on the gums of my child. So what that's going to do is antisepsis for the gums, so it stops infection getting into the baby, so we don't have to worry about that so much. Secondly, it numbs it. And what that does is it enables the child to eat better and not feel such heat. So the numbing flavor of that is going to be really good. It's also very drying of mucus, so it's going to help dry out the gum so the teeth can come through better. As always, Mother Nature has the best design, because one single clove has got the perfect amount of oil to be able to do that. So we would then chew that and swallow that because it's a good prebiotic to feed our good bacteria and to kill off bad bacteria. So one single clove, perfect remedy for how to help your child with teething. What you can also do is make sure that you massage the gums, you release the tongue, you free this area with the sphenoid adjustments, the sublingual adjustments, all of the mucus draining techniques that we've shown you in our seminars, or a good chiropractor will be able to release the face of all that pressure. If you have any questions, follow for more and learn more tips and tricks on how to look after kids when they're teething. The third thing is they will commonly rub in here to make sure that they're creating pressure release. That's something that we want to do. We want to recognize the difference between rubbing your gum and rubbing your ears. It will not necessarily be signs of ear infection, but it's important to see where they're rubbing. Finally, there is a technique called the jam jar technique where we help to loosen the cranial bones here. Put our hands like this, and parents can do this too, and you're going to shear like you're opening a jam jar very gently, no more than 1 or 2 millimeters of movement through this region will loosen and free up a lot of that heat that's building up in the sinuses as the gums and teeth, the gums are erupting and the teeth are coming down. Secondly, you can pull up here to help stretch through this cranial suture, and lifting like this will open that space too, again helping to make sure that all that heat and throbbing is dispersed from the body, not building up in that area. If you'd like to know more information, send us a message or contact your great chiropractor in your area to help adjust this child and walk it along the path of normal function in the body.